I had symptoms of a sore throat and headaches and body aches, basically. And then with where I work, the policy is that if you have any of those symptoms, basically, you then have to actually go to the doctor. And then I went, after the testing, I then started isolating by myself at home, basically. That's how I started. The thing is, we live in unprecedented times where we didn't know basically what was happening. So I think anxiety was the major thing that was playing with my mind, because I was really scared, and especially seeing the stats every day rising and the deaths and everything like that. So I was actually very scared that anything could happen. Okay, when I was isolating by myself, I used to listen to gospel. I didn't watch TV. With me, I wasn't watching the news, the stats or anything like that, because at that stage, because already I'm already fighting for my life, so I didn't want to know who was dying. I didn't even want to know when you'd get calls, people saying, "Hey, did you hear about somebody who passed away?" I didn't want that. I didn't want anything that was negative, especially when you are low. Especially because one of the things that happened to me was as I mentioned before, the two near-death experiences that I experienced, basically, due to the anxiety.
Yes, let's unpack more the near-death experience. When you say your near-death experience, please explain more on those.
I was actually on day 5, and I still had not received my results as yet. I was still waiting. So I then suffered a panic attack basically, where I couldn't breathe at all. And I was doing everything, the breathing exercise and everything like that, but I could not. And then I tried calling the ambulances and everything like that.
Did you at any point think about death? That's, I'm going to die?
All the time, actually, all the time, sorry. If there's one thing that I used to actually sleep, listening to music. And most of the time I didn't sleep because there was a group on Facebook called the COVID-19 support group. I think that's the one thing also that actually helped me, because I would log onto it, and at 3 a.m., 2 a.m., you'd see all these other people online and like supporting each other. The emotional support it came from different places, from my colleagues as well, because they would actually, while I was still isolating here at home, they would bring me medicine. I would tell them that, listen, I've run out of this. My sister would bring me food at times and everything like that. There came a time where I actually saw that I couldn't do this alone. I couldn't isolate alone, because I felt that it was actually killing me, especially after the first near-death experience. So then what I did, I then went to Nelson Mandela Stadium, where it's a quarantine site. And then that's where I actually recovered from day 6 till day 15. I feel after experiencing COVID-19, I've become a better person, basically. I tend to appreciate life even more. I tend to, as I said, I'm a much happier person than I was before, and I'm more grateful. And I always try to do more, and as I said, offer emotional support to many others and other people as well.
So, the lockdown and COVID lockdown, has introduced a lot of challenges to mental health generally. That was what you've just heard now is Fezile Papu sharing his experience after testing positive for COVID-19. Now, we do know that COVID-19 affects just more than our lungs and our hearts. This pandemic has also introduced serious threats to our mental health. Now, worldwide, it has become increasingly clear that the coronavirus may affect the brain and mental well-being of patients long after the body has recovered. A term, COVID fog, has been coined to describe what some people experience. In our country, the National Department of Health expects that the pandemic will increase the need for mental and psychosocial support of our people for the next few months, if not years. So today we have a specialist psychiatrist who will explain to us just how COVID-19 affects mental health of patients, not only during, but particularly after they have recovered. Welcome to Health 2020, Dr. Dr. Lerato Dikobe-Kalane. Now, we've just heard a classical example of anxiety, one of those conditions that, can linger on for, a long time. And yeah, it's a pleasure to have you again. Dr. Kalane, by the way, is a specialist psychiatrist in private practice out here in Johannesburg. Now, perhaps let's just, before we start getting into discussions around anxiety and so on, let's start off by looking at that impact COVID-19 has on mental health in general. Not only, I suppose, on the person that's infected, but even in terms of, those around the person that's infected.
So the announcement of COVID-19 pandemic, I think, to the general population, heightened the levels of stress and anxiety, because now we are being told that our lives are in danger and we are endangered by this invisible enemy. And then our president then announces that there's going to be a national lockdown, there's going to be curfews, people must stay at home, only leaving their homes for essential services, essentially. So people are now locked down, there's fear, there's panic, people went on panic buying because we didn't have enough information.
Right.
So with the general population, there was an increase in stress and anxiety, more so for people who are already living with mental health challenges.
Right. So I mean, we described earlier on the common mental health challenges that people experience. Obviously, we're talking here about a society that already has a heavy burden of mental health conditions. But we're told now that there are mental health conditions or symptoms that appear to be lingering on, quite some time even after recovery. I mean, I started by describing COVID fog, or at least I mentioned it in
brain
my
fog,
introduction.
yes.
Perhaps starting with that, could you just take us through some of those common ones that tend to linger on afterwards?
Yes. So over and above affecting the lungs, the virus actually causes a cascade of an inflammatory reaction, which can then affect the blood, the heart, and yes, the brain to a certain extent. So people who have recovered from COVID-19 do describe what is called brain fog. And it's not a phenomenon that is unique to COVID-19, but it happens in people who are also sleep deprived or who have nutritional deficit. And it's more describing that my brain is not as fine-tuned as it used to be. I'm not able to remember or recall things as acutely as I used to be. So it's more like a mild neurocognitive impairment of sort.
Right. But are there any other psychiatric illnesses that tend to,
It would be either directly or indirectly. So while a person is severely ill with COVID-19, we know that because the lungs are affected, the oxygenation of the brain would be affected, and that can lead to a person developing delirium, which means a person's state of consciousness is altered. So they can present with confusion, hallucinations, and abnormal speech. So that's the direct effect. The indirect effect is, again, that anxiety, the depression, and sometimes even delusions and hallucinations brought on by excessive worry.
All right. The other concept is people that have been severely ill from COVID-19, whether or not they go on to then, experience some of these conditions that we spoke about earlier. I mean, there's one that's been described as post-intensive care syndrome. What exactly is that?
Yes. So post-intensive care syndrome is a combination of physical, psychological, and cognitive symptoms. Not unique to COVID-19, but it's a general experience of someone who has been in an intensive care unit for more than 3 to 4 days. And because your muscles have not been functioning daily, you would find that there would need to be a physical rehabilitation in order to help, especially the smaller muscles in the hands and in the feet, just to be able to function properly. Psychologically, it's that fear of being in ICU. The person in the bed next to yours demises, so you become very fearful. The doctors come in with these worried looks on their faces when they look at the machines. They say the numbers aren't right. So again, fueling anxiety and fear of death. And then cognitively, it's again that brain fog.
All right, so let's put a comma to our discussion. We're going for a quick break. When we come back, we'll continue our discussion and, of course, answer some of your pressing questions on mental health. Please stay with us. Welcome back. If you just joined us, we're talking mental health post-COVID-19 recovery with our special guest, specialist psychiatrist, Dr. Lerato Dikobe-Galane. Now, Doctor, we spoke earlier about, all of the conditions that can linger on and so on. The one question that we haven't addressed is the risk factor for that happening. And I do know and accept that. I mean, obviously, we're all learning about COVID-19. It's a new phenomenon, and all information is coming through today. But do you have a sense of what are the risk factors for people developing these things, for a very long time after recovery?
Yes. So people with pre-existing mental health issues, but also people that have been sick with COVID-19. Frontliners are also at a very high risk, or people who have witnessed or experienced the loss of a family member due to COVID-19 will then stand a higher chance of developing, either depressive episode or an anxiety disorder.
All right. So again, I mean, understanding the risk factors, can we even talk about prevention perhaps? Or is it really about prevention in general, about mental health conditions worsening?
Yes. So with the general population, the preventative strategies would be what people were advocating during the hard lockdown, that instead of social distancing, it's more physical distancing. So when the word was coined, social distancing, I think it threw us off as mental health care providers, because we need people to be socially connected in order to get the necessary support. So don't kill your social networks, even though you might not be able to see each other physically, but continue with that. So really the social support system, exercising regularly, eating properly, sleeping adequately, and not allowing yourself to be bombarded with, negative news in the media, staying away from social media that spews negativity, but rather social media that's more uplifting and positive.
Yeah, and I mean, we had that concept coming through from, Fezile Papu talking about just how he avoided the news. Yes. Now, we've put together some questions that we received from, our viewers, and would like your thoughts on them. We'll go through the first one. Ever since I was discharged from hospital, I have fears that I'll be reinfected. I permanently wash and sanitize my hands and prefer keeping my mask on too at home. How can I relax? This is Kolile from Weinberg.
Yes. Kolile has suffered quite a huge trauma. You remember, these are unprecedented times. This is a virus that not a lot of people know much about. So this has been a very traumatic experience in him. So he's presenting with symptoms of post-traumatic stress disorder. So the hypervigilance, the avoidant behavior, and the hyperarousal. So the hyperarousal is that fear that he fears being reinfected, and he thinks about it all the time. And in order to avoid being reinfected, he then does compulsive hand washing and sanitizing, then bordering on obsessive compulsive symptoms.
Yeah. Well, I guess the question is, where do we draw the line? I mean, it's necessary that people should wash their hands regularly and sanitize. At what point would you then say this is really bordering on obsessive compulsive?
If it starts interfering with your normal social and occupational functioning, then we say it's a disorder.
Right.
But if you clean yourself frequently, as long as it doesn't take up too much of your productive time, then we can't say it's a disorder.
All right. Let's go through our next question. This is from Fahmin Pantan. It says, my sister-in-law was discharged from hospital after spending a long time in ICU. She appears fine, but how will we know that she has depression? That's an important one.
Yes. Yeah. I get it's that social support, the fact that she is concerned about a loved one who has just recovered from COVID-19, and she is being so attentive to how the loved one is doing. So again, checking in on your loved ones, asking emotive questions, not, hey, how's it? But hi, how are you? How are you feeling? Are your lungs feeling better? Are you sleeping adequately? Is there anything that you need? Is there anything that you're struggling with? So the loved ones would be the ones to pick up if there is a change in behavior and then advise adequately.
So what sort of change in behavior perhaps should they be looking at?
So if the sister-in-law becomes maybe unusually quiet, starts socially withdrawing, maybe not being as bubbly as they're used to seeing her, you know, and if she's complaining that she's not sleeping adequately,
And of course, then
obviously
they can advise that
refer and say, you know what, go and see somebody, maybe
Right.
you're not coping.
Right, right. Okay. Let's go through our next question. This is from Balfour, Nozandulela. I lost my brother through COVID and never saw the body during the funeral. My mother is worried that this will affect you. Of course, this will affect us in future. And what can I do? This brings quite a few issues here. I mean, the first obvious one being our normal cultural practices not being able to be practiced, you know, during this time of COVID-19. And I guess the question is, if there hasn't been closure, is there a possibility that this will negatively affect people going forward?
So this pandemic has really left a trail of destruction, not only to people's physical beings or people's individual psyche, but also societal psyche. We know that it is our African practice that when a loved one has passed on or a significant person has passed on, you know, in Sesotho we say Ramui Tloboga, you know, so there's viewing of the body, the family mamas will go and wash the body and dress the body. It's all part of mourning and really helping people to get closure. Now with COVID-19, somebody has passed away in hospital, you were not able to see them while they were hospitalized, while they were sick, and then you get a phone call to say they've demised and they're wrapped in plastic and the coffin is sealed. It's exceptionally traumatic. As to how it's going to affect the society in future, we don't know as yet, but we do need to be proactive in trying to prevent, you know, the sequelae thereof. So as a family, my advice would be talk about the feelings, talk about, you know, what you would have wished to see happening, how it makes you feel, and if it means you get, you know, a third party to come in and facilitate the conversations, we need to do that in order to prevent mass depression.
Right, right. Let's go through our next question. This one is from Shepherd, from Welcome, says, my wife is a nurse and has been treated in hospital with severe COVID-19. When she came back home, our neighbors retreated and avoided her. While I don't care about their behavior, she's very irritated and stressed about it. How can I help her? Again, the stigma issue coming through.
Yes, stigma. Stigma is fueled by fear, fear that is fueled by ignorance. So that which we don't understand, we fear it and then we stigmatize it. It's really about your own internal resources. You know that you have recovered, you are not a threat or a danger to anybody. Those out there might not know that because they don't have adequate information. If she is unable to use her own internal resources to cope with that, I mean, if the husband is noticing that she's now becoming more irritable and stressed, perhaps her own internal resources are starting to fail her. And maybe she does need a mental health care provider just to help reinforce that with some cognitive therapy.
Absolutely. Yeah. Let's go through our final question for the day now. This is from Johan from Belabela. So my friend was treated for depression about 2 years ago. She contracted COVID in June and spent 2 weeks in hospital. Will her depression come back?
Yeah.
Well, that's the, what we spoke about earlier, the risk factors. If you've had, a pre-existing condition that was successfully treated, is it possible that COVID-19 can sort of trigger a recurrence?
The good thing about a major depression is that it can fully remit. If adequately treated, a person can be cured or be in full remission.
Right.
And it was an episode that happened 2 years prior. She does not necessarily have to dip into another depressive episode for as long as she is mindful of her emotions and her thoughts in order to prevent herself from relapsing again.
Right. I think just finally, before we run out of time, I mean, we spoke about all of these conditions that we described. Is there any different way that, treatment and support for people who suffer from these long, recurring and, symptoms that appear to linger on for a while? Is there any difference in approach?
Not necessarily, but I think it's more people having enough information, people knowing that you don't need to live in fear all the time.
Right.
You can reach out and get help. There are a lot of us who are using virtual mediums in order to make our services available if you can't go and see the doctor physically.
Dr. Lerato Dikobe-Galani, thank you so much for your time and insight. I hope we spend some time again together in the near future. All right, so that's how we come to the end of this session. We're going for a quick break, after which we'll summarize and leave you with those important take-home messages from today's show. Welcome back. Now, here are these key messages we want you to take away from today's show. Now, firstly, we do know that mental health issues are frequent in South Africa, and we said that these are experienced by 1 in 3 patients even long after recovery from COVID-19. Now, what sort of symptoms can linger on after recovery? Well, COVID fog, as we described, and we also have fatigue, sleep disturbances, headache, anxiety, depression, post-traumatic stress disorder, post-intensive care syndrome, as we explained. Now, in terms of caring for your own mental health, please keep a usual routine. Take care of your body by eating healthily, exercising enough, and ensuring that you get enough sleep. Avoid drugs and, intake of alcohol. And of course, very important that you connect with your loved ones and friends and talk to people. Express what you're grateful for. Now, take a break away from all these negative news. And perhaps, if you can, learn some new techniques like meditation or yoga to relax. And please seek help early if you need to. Now, if you feel that you're not coping after recovery, please seek professional help as soon as possible. There are lots of helplines out there that are available. First SADC 0800 456 789, or you can reach them at their landline, which is 011 234 4837. Alternatively, the Mental Health SA at 021 938 9229. Well, folks, that brings us to the end of our show today. We want to thank you so much for all your questions and, of course, watching our show. Now, next week, we're back with a subject of HIV. If you have any of these questions, any questions relating to the subject, please send these via WhatsApp, SMS, Twitter, Instagram, Facebook, as displayed on your screen right now. And until then, please do take care and please stay safe.